Good evening. We have in our midst Dr. Leelavati Thakur, critical care in the Mission Hospital, Durgapur. We welcome you to Natco Pharma Specialty Studio this evening, and we look forward to listening to you on what you've got to say about the critical care and the bacterial resistance treatments. What have you foreseen is the changes in critical care management?
Thank you for my introduction. For the newcomers in critical care, it's really it's a big time that they should think about. I mean, containing the antibiotics, the restricting the antibiotics, so that we do not abuse, misuse, or overuse. So, in that sense, the only weaponry we have is the antibiotic against the sepsis, and we should protect its usability in a very meaningful usage. It's not that we are going to give at random any antibiotic to anybody, and we should not be using it for more than the time that is permitted. If you give wrong antibiotics to wrong patients, overuse or abuse it, then we are going to land up in bigger trouble. The patient may have a fungal sepsis or something like that, and patient may not recover ultimately. We have seen one patient who had got meropenem for 30 days because patient was continuously having fever, and ultimately it was seen that he has grown candida, and that too a glabrata variety in blood. So it's very, very important to restrict and the usage and not to abuse or misuse antibiotics.
So you have also answered in short the advice to the ICU doctors. So you've already spoken a bit of it. Any other advice that you want to give the doctors of today in patient care?
Yes. For doctors of today, please go to the bedside of the patient to examine the patients. Do not rely on others, what others are telling you. You should be examining the patient yourself. If you examine the patient yourself, you can find the exact cause of his or her illness. So it's a very, very important thing.
So very important what you highlighted is go to the bedside. My third and final question to you is what is the prevalence of carbapenems producing bacteria, right? And what is the treatment options?
Generally, carbapenems producers, they are being now treated with the sulbactam, avibactam. These are the mainstay of this carbapenems producers, and along with that, the beta-lactams with some EDTA. Generally, we prefer that. This is how we go in for this carbapenems, this thing. And for MDR Pseudomonas, generally we prefer aztreonam to be added on, and rest, everything is like that.
Thank you so much, Dr. Leelavati, for spending time in our studio this evening. And we value whatever you have given to us. We wish you all the best in your practice.
Thank you very much.